So to minimize the risk of flaring, the most important things patients could do is take their medications, come to follow-up visits even if they're feeling well, and get the required blood work and stool tests. So when symptoms worsen, it could be Crohn's flare, so more inflammation on the inside. It's important to communicate with the provider so then they could better help figure out what's driving those symptoms. Is it Crohn's or is it something else? I wouldn't recommend rushing to taking something over the counter or adjusting or increasing medications without getting a better sense on what's causing the symptoms. Smoking cigarettes is the worst thing you could do for Crohn's disease. There's many studies showing that it worsens the course of Crohn's disease, so how complicated that Crohn's disease is. If you have surgery for Crohn's and you smoke cigarettes, you're more likely to have another surgery and the disease to come back. And if you're on medications for your Crohn's disease, such as your biologics, there is some evidence showing that people do not respond as well to biologics if they smoke cigarettes. Many studies have shown that exercise, sleeping well, being on a well-balanced diet, people feel better with their Crohn's disease. It improves the quality of their life and it minimizes the symptoms. Also, stress reduction. Sometimes going to yoga or going to the gym, you get your exercise, and that could also reduce stress as well. There's no perfect diet for Crohn's or ulcerative colitis. How you feel is different than what's happening inside. So going on a certain diet or restricting what you're eating may make you feel better, but inside things could be the same or actually getting worse. When you're in an active flare, when you have active symptoms, that's where foods high in fiber may worsen the symptoms. Symptoms that can be controlled by over-the-counter medications. So frequent bowel movements or diarrhea could be controlled with over-the-counter anti-diarrheals. Fiber supplements are underutilized and could help bulk up stool, possibly cause less cramping and less looser bowel movements. For pain or spasms, that's when I like to prescribe a mild antispasmodic. What you do want to avoid over the counter is the NSAIDs or non-steroidal anti-inflammatories such as ibuprofen, naproxen, and aspirin. So what patients could do to really manage their Crohn's is to be an active member of their care, discussing their concerns with their physicians,